first thing you want to do is go down to the hospital storage room um, and make sure you find your O2 tanks that are clearly marked. These are marked on the wall. Um, and the O2 tank should be safely secured to the wall, either with a chain, an individual transporting device, or in a rack. So here's our oxygen tube. We want to confirm that it is O2. In America, O2 tanks are green. This one is green. You want to inspect the tank. Look for anything that would affect the structural integrity, dings, dents, etc. This one looks good. Next thing we want to do is we want to what we call cracking the cylinder. What this will do is clean out any of the debris in this hole. So then you just want to give it one quick little turn before you do. You want to announce that you are cracking the cylinder so everyone in the room can hear you. Cracking the cylinder. Okay. Once that's done, you want to grab your regulator. Make sure that the O-ring washer is on there, and then we are going to match the pins on the regulator into the hole. Okay, and then we are going to tighten the regulator on, and then we are going to open it for one full turn. After it is open, we are going to turn on the flow meter, and we are going to occlude the flow meter, pressure and everything still looks good. Okay, I'm going to turn that off. Okay, and then we are going to close this for now. And this is going to be ready to be transported to the patient's room. When transporting it, you want to make sure it is in one of these secure safety devices for traveling. If you have to attach it to the bed, you want to make sure that it is on its side. If you're in a cart, you want to make sure that it is secured either with a chain or in one of, I can't see it, one of these devices, which is just one of these multiple, that carry multiple tanks. Then you want to go to your patient's room, make sure that you have the correct patient, confirm their name, date of birth, ADED, etc. And then you want to educate them on safety while using an O2 tank. First thing, no smoking, as O2 is an accelerant. And then if they have any nasal dryness, etc., they don't want to use any oil-based products, or you don't want to keep oil-based products of any type near an O2 tank, as that is also an accelerant. Explain to them that they cannot keep their O2 tanks on anything high, to where it may fall and affect the structural integrity of the O2 tank. And then for transport, as I said earlier, you want to make sure it's laid on its side, so it cannot fall and become damaged, or it is secured in one of these or chained to a wall. Next thing you want to let them know about is when to change out tanks. You want to get them when they get down to about 500 psi. This one is at 2200 psi. This patient is going to be on 2 liters per minute. Nasal cannulas, that should give them about 5 hours of use. Okay, next thing we're going to do is we're going to bleed out the cylinder, make sure that it is closed. So turn on the flow meter, watch the gauge go down to 0. Okay, and then we are going to turn that off. We are going to detach the regulator by unscrewing it and slide it right out.